Welcome back to The New Health. And back with us today is Dr. Cheng Ruan, CEO of the Texas Center for Lifestyle Medicine. Welcome back, Dr. Ruan.
Thanks so much. I'm happy to be back.
So today I would love to talk about, we've talked about groups, what you're doing in work,
Yeah.
and I'd love to talk about the work you're doing in mental health,
Yeah.
and talk about the mental health crisis.
Yeah, absolutely. So, whenever we say the words mental health, I think it means different things for different people. To me, there's no distinction between mental health or brain health or physical health, because we know that mental health is stimulated from the environment and the relationships that we have. And as human, we all have the same struggles, right? And so I think mental health has gotten a bad reputation because the concept is that in a westernized society, sort of the go, like let's keep high-paced society, is that we almost have this idea that mental health is something that I can just deal with, right? It's true, you can also deal with physical health as well, but what happens is people don't tie the physical health to the mental health aspect of life, because we know loneliness and isolation is the #1 risk factor in driving all chronic disease. It doesn't matter if it's cancer, diabetes, et cetera, right? So we can't see it as two separate things. And so my dream is this. My dream is not to call it mental health, it's health, it's part of health, right? But my dream is also to honor mental health even before physical health, because your behavior changes everything in all disease states, even if you have a family history of it, right? And so, and that is the big dream here. And so the challenge is it's not accepted in the medical community right now. And the other challenge is insurance has like mental health benefits and then medical benefits, which is dumb. But I see why it was done, but it also marginalized the psychiatrist as someone who's just trying to get someone to do something. So almost like they're manipulators, but that's not what psychiatrists do. They're very loving people. And so the field of mental health, I think, requires that big paradigm shift.
Oh, that's great. So we're talking, you said, keeping mental health and we have physical health separate, and having them together and having them just as an overarching umbrella of just overall health.
Yeah.
But I think as patients or people, when we think of mental health, we think, I'm feeling a certain kind of way, I need to buck up. And they kind of go from there and then just keep on plowing through. If we can talk a little bit about that,
Yeah.
and then what happens with your health in that state.
Yeah, I'll tell you that through stories.
Okay.
So someone can come in and their posture's like this. Maybe they got dark circles around the eyes, they haven't really slept. They come in and the blood sugar is kind of high, right? And their foot kind of hurts, okay? And so what happens is that there's stress that's being dealt with by the person, or even depression, and it's affecting the posture, and it's affecting sleepless nights, right? So what happens is that when you carry your stress here, your shoulders comes up, okay? And when your shoulder comes up, you have muscles in your neck that get contracted to keep the collarbone up, the clavicle, as well as the first 3 ribs. Well, what do the ribs do? They allow you to breathe. They allow your lungs to expand. So what happens is if you don't move around, or if you're having shallow breath, which a lot of people with anxiety do, then your lungs literally will collapse, especially on the bottom part. So this is a term called atelectasis. Back when I did hospital medicine, we saw in the ICU all the time. And then we had to get the patients up in physical therapy, walk in, even psychotherapy and counseling to get the people to brighten up. So why? So they don't develop pneumonia from the lungs collapsing in the hospital. Well, that's happening out in the real world as well. The other part is screen time. All right, mental health and ADHD and ADD in kids, it's associated with increased screen time. What happens when you're playing games and stuff on the screen? You're also not breathing. Everything's up here. So excitation also restricts your body to breathe. And guess what? We need air. We're aerobic creatures, right? So it affects the way we breathe. It affects our posture, and it actually decreases the way we detoxify. So if your posture is like this, where your head's tilted forward, you get a little bump in the back of your neck, and your shoulders up right there, the channels to detoxify the brain gets blocked up, and then you develop mental health issues. That's even worse. You develop dementia and memory loss, right? And so there's this beautiful system of detoxification of the brain called the lymphatic system that has a plumbing problem now because you can't like dump the toxins from the brain, right? So what does that affect? It affects your hormones, it affects neurotransmitters, it causes early menopause, it causes early menarche, right? It causes the ability for cells to divide really rapidly, which means at the end of that we call it cancer, right? Mm-hmm. And so there's mechanisms that's modified by the way that we breathe. And as a society, we're constantly suffocating. And that suffocation triggers these mental health disorders. And that's the big problem that we're trying to face right now. So we can't see mental health as something that's different than physical health.
So what I'm hearing from you also is, so in the very beginning of that story was somebody who was saying, I'm not feeling good, I'm feeling anxious, depressed, dysthymia, low-grade depression, something like this.
Yes.
I'm gonna buck up. And then they go through that cascade of events that you just discussed. And then at the end of that, it exacerbates an even greater mental health disorder.
Yes, the term buck up, where did that come from? Well, you're about to get on a horse is about to buck. You're about to buck back, right? So it's a fighter stance, right? And as in a fighter stance, you're not breathing. You're waiting for someone to punch you or you punch them, that fight or flight stage. But what's happening is that the other opponent may really be your thoughts. And it may be your expectations of yourself that you're not meeting, right? It may be beliefs that may be limiting. I'm not worthy, I'm not good enough. I have to have everything perfect. I am not safe. So these are examples of beliefs that may be limiting us, that's triggering our posture to kind of clench up. And we have this beautiful network of connective tissue called the fascia, F-A-S-C-I-A, if you want to look it up, the fascia. And the fascia's job is to protect us. It puts us in, I call it the roly-poly mode. We kind of roll up, and that's what bucking up really is, right? But you can't breathe when your fascia's tight. You have pain. You get issues with joint pains and muscle pains. You get issues, and it can long-term lead to things such as fibromyalgia or plantar fasciitis or TMJ issues, right? And so what we're seeing is that doctors right now are just kind of treating the physical symptoms, but what about the bucking up? The bucking up is the actual origin of why these things are happening in the first place. So we have to train people either not to buck up or get them to figure out, if you're bucking up, what are you really bucking up for? What are you fighting, right? Is there really an enemy, or is there a perceived reality that has to be shifted? And I'll tell you my most greatest equation, math equation of all time, is expectations minus perceived reality equals disappointment. So the higher expectations are, the worse outcome you have, outlook you have for yourself and perceived reality, the higher disappointment. And I'm not telling people to lower their expectations, I'm telling people to flip the perceived reality to a much higher perceived reality. And that's what we actually do at Texas Center for Lifestyle Medicine.
I think that's great. So that buck up, I think what the disservice we've given to ourselves is we are in a society where we're told the more you do, the more we should be proud of ourselves, and the people in our lives should be proud of us as well.
Be in a hurry to don't and not be in a hurry to do. When you don't, you become present, grounded in the present. When you do, you become grounded in the future. We call it anxiety.
And if you are in that space of don't, where you can be present, then do you find that people are having less of that, buck up feeling, less of that, grind?
Yes, however, we have to honor the fact that the buck up feeling allowed us to be born, allowed us to exist the way we are. The bucking up feeling is required for multi-generational survival of Homo sapiens, of humans, okay? There's nothing wrong with bucking up, but when you do it for 24/7 and you can't sleep, that's where it creates disease. And disease is dis-ease, uneasiness, right? Disease started from dis-ease or uneasiness, which starts from discomfort, right? So if you're bucking up all the time, it's not really comfortable either.
How are you helping people find that balance? Because we do know we need resilience, and we read about resilience. We must still be resilient in some way, but we're just pushing it too far. How do we help those people that are in that space, which is the majority of people, find that balance?
It's very simple. It's two words, and a lot of times I say people get uncomfortable. It's called unconditional love. Unconditional love. So unconditional love means this, is we will provide connection and love without a condition. You can be bad, you can be good, you can be whatever you are. We take you as you are, right? Doesn't matter your race or gender, what you identify with, doesn't matter what history you've had, what family history you have, like what socioeconomic status. Like, show up, be you, be authentic. I'll show up and be me, I'll be authentic as well. And then when we have an authentic conversation, that's where safety comes in. It's a really, really easy thing to do when we're able to show unconditional love.
I think that's amazing. So unconditional love, it sounds, and I know it sounds easy, for unconditional love, that starts with your loving yourself, loving your closest people to you, finding that you are worthy. This is a challenge.
It's a challenge, but you got to put the mask on yourself before you put on someone else, right?
Absolutely.
And that's how humans have survived so many generations.
And back into that whole sense of community.
The community, and then decreasing the sense of isolation and loneliness, and we have to kind of take a step back and think, like an audit, like where am I? What am I doing? Who am I talking to on a daily basis? Is this belief system still serving me, even though at once it did before? That's the most important question.
That's incredible. And then people can be in that community, find that their nervous systems can relax a little bit.
Yeah.
They can then open up, allow themselves some of that, more of that unconditional love, and it just seems like it's probably a bit of a cascade where it really just seems to explode for you.
It is a cascade. Health and disease is not a battle. It is a gift for us to look at ourselves deeper, to figure out what reality do we want to live in the future.
Dr. Ruan, thank you so much again for being with us today. Will you please let everyone know how they can find you and what you're working on right now?
Yeah, so what I'm working on is a lot of technology and artificial intelligence introduced into medicine, so we can actually look at how people are living purposefully. That's what we're doing at Texas Center for Lifestyle Medicine. So we have dietitians and health coaches, we have psychotherapists, et cetera, we have MDs, we have nurse practitioners, a huge team actually. And every member of our team is designed to create that sense of balance, that sense of unconditional love, if you will, so that people can come in and actually feel safe. You can find me, Cheng Ruan, MD. I'm on Instagram, I'm on LinkedIn, I'm on Facebook, I'm kind of everywhere. I have a YouTube channel as well. But I'll be putting out a lot more content, and you'll see a lot of me and my family, especially my 3 lovely little girls, as I interact with them. I'm very much into this phase of my life, I'm 41 now, where I want to talk about parenting and love quite a bit.
That's wonderful. Well, thank you again for joining us. Well, thank you so much for joining us at The New Health. Join us again next week when Dr. Ruan will be back once again. We'll see you then.
This has been a Now Media Networks feature presentation. All rights reserved.